C200 Respiratory. Capenergy launches the first respiratory Tecartherapy equipment with medical CE certificate for the treatment of asthma, the C200 Respiratory device. The great importance of this invention is the fact that it is the first certified device that fills the current gap between pharmacology and respiratory physiotherapy based on inhalations and mobilizations. Until now, there was no clear technological solution that offered an effective therapeutic response to pathologies of the lower respiratory tract, such as asthma, or the upper respiratory tract, such as pharyngitis or other conditions that occur with inflammatory processes. Thanks to this innovative option, the patient has a scientifically endorsed treatment, certified by the health authorities to effectively treat their pathologies. Let's see how it does it. In the first place, it is important to note that this device uses a very specific therapeutic target and that it has proven to be the most effective at the moment. This is the vasodilation and relaxation produced by the increase in endogenous temperature created by the device. Thanks to the increase in blood circulation, as the temperature rises, a reflex effect is produced that attenuates the bronchospasm and lets the air flow back into the pulmonary bronchioles. In the case of inflammation, the powerful anti-inflammatory effect generated by the C200 respiratory device improves the experience of inhalation and exhalation. Well, now Capenergy has combined these two therapeutic targets into a single device on the market that allows maximum therapeutic intensity and efficacy to be achieved. This is how the C200 respiratory Tecartherapy system was born. The C200 respiratory device is a certified medical device that is indicated for the indication of asthma. Thanks to the ability of endogenous thermotherapy to transform the state of matter, this device is not only invaluable in controlling inflammation and relaxing asthmatic contraction, but also favors the passage of gel to sol, reducing the viscosity of the mucus stored in the respiratory tract. Stimulating the liquefaction of mucus, the C200 respiratory device helps the patient to expel it more easily. This mechanism is helpful, especially for children who have difficulty managing their mucus. Mobile and automated application. In the case of asthma treatment in adults, two large area accessories are applied to the patient's chest, fixed with an elastic bandage. These plates close their circuit in two passive plates located in the dorsal thoracic area. In this way, an energy circuit is generated where the energy is directed towards the pulmonary bronchioles selectively. These accessories have a temperature sensor that controls the energy delivered and avoids any inappropriate sensation for the patient. It is a non-invasive treatment without side effects and of a pleasant nature for the patient that feels a deep sensation of a tolerable heat. In the case of treatment in children, the application of energy is done in a manual option, moving a hand probe over the patient's chest with a soft massage and stimulating the elimination of mucus in the most compromised areas. The efficacy rate in the treatment of asthma is high. Already from the first session, 90% of treated patients say they reduced bronchospasm by 80% and increased their lung capacity by 70%. As the studies carried out by recognized hospitals and researchers reveal, the results leave no doubt that there is a before and after in the technology with the invention of this device. Our current experience in the publication process demonstrates an improvement in respiratory symptoms after 4 weeks of radiofrequency treatment in both lung fields. This technology finally offers quality results in short times. In addition to the quality of care, the C200 Respiratory stands out for being painless, having no negative side effects, and for being an operational and profitable working instrument for the professional. Thanks to its use with protective covers, the treatment is economical for the patient and easy for the professional to apply. Let's know now what some of the professionals who already use this technology think. In short, the Capenergy C200 Respiratory Tecartherapy device fills the gap that currently exists in the pharmacological treatment of asthma and the respiratory exercises of classical respiratory physiotherapy. Until now, one could only opt for palliative measures or to perform physical therapy exercises when a crisis was suffered. Thanks to this important technological innovation, a quality result can be obtained, scientifically endorsed and certified by the health authorities through a simple, safe, hygienic, efficient and economical procedure for both the operator and the patient. Many professionals have already contrasted it, and thousands of patients have benefited. Know all the benefits that the C200 respiratory device has to offer. Capenergy, at the forefront of technology in respiratory physiotherapy and asthma.